Hello everyone, this is Anthony Moss, hopefully the next President of the United States. In this video I would like to go over healthcare reform and my plans for doing such. So first off, I would like to state that I believe that healthcare should be a right for all, and I believe I heard that it was Canada who it was their constitutional right to have healthcare. And it would be nice to implement that here as well. So I believe that healthcare should be a right for all Americans. As of right now, there are tens of millions of Americans who do not have healthcare coverage. They don't have healthcare insurance. And out of the people who do have healthcare insurance, they still have to there's still some business with that. So in other words, they have to deal with their employers if they're employed through their employer, or they have to deal with whatever government program they may be employed under, like Medicaid, Medicare, which doesn't cover everything. They also may have to deal with the hospitals, and they have to deal with the pharmaceutical companies. And it's the pharmaceutical companies who, I bluntly say it, are the ones that are jacking up the prices of medication, and making it so hard to afford in many cases. And hospitals, as many people know, can be very, very expensive too. So the thing is that pharmaceutical companies, insurance companies, hospitals, they want your money. This is why medication is so expensive here in America. If you don't know, pharmaceutical companies, like to deal with politicians and stuff like that, get things kind of done in their favor, so on and so forth. Pharmaceutical companies, they keep prices high, and in many cases increase prices. When these medications are affordable in other places. There was this wasn't too long ago, I want to say it was back in 2016, I think, I'm not sure, where it may have been 2015, where there was this big issue about, I think it was the company behind the EpiPens or something like that, where they jacked the prices, way, way high. And practically argued that, hey, they want to make their money, and that's not right, when it comes to lives. If you've gotten in the business for, this is a business for, saving lives and taking care of people in the healthcare field or whatever. So that responsibility should be on you. Just my belief. But anyway, pharmaceutical companies, they'll take your money, jacking up medication prices. Health insurance companies, they may only cover you but for so much. You're still paying, whatever it is that you're kicking out, you're still paying. And you may not even be getting full coverage. You may not be getting, everything taken care of. Or even with the coverage that you do have, you still have to come out of pocket for medication or for some of the healthcare services that you're receiving. And in hospitals, you may have to go to the emergency room for some kind of pain or something that you're going through, and you may get treated with Motrin, or you may get, an IV, to increase your fluids or electrolytes or whatever, and then you're sent out the door with maybe a $2,000, $3,000 bill, and I know there's people out there, who understand where I'm coming from with that. So they want your money. Healthcare is not affordable for a lot of people, and that's not right. So, it's just my belief that healthcare should be a right for all of us, and that's possible. A lot of other countries have universal healthcare programs, and I believe that should be the same thing here. So, in talking about other countries, they have affordable healthcare. They have affordable medication. We're paying twice as much as many other countries that have some some type of universal healthcare system in place. And with the way that things are, there's no reasonable, the way that things are now with our current healthcare system, there's no reasonable cap on medication prices, which means that you may be coming out of pocket for expensive medication, and in 2 or 3 years the price of that medication can go up, even though it's already pretty expensive. So, and the same thing actually could occur with healthcare costs. There are services that are old, that are outdated, and for whatever reason the cost of those services go up, in time and stuff like that. So I mean, we're just paying too much for healthcare, or we're not paying at all because we can't afford healthcare, and therefore we're not seeking healthcare. And there are people who are going on injured, who are going on, sick, who are going untreated because they can't afford healthcare. They don't have health insurance, so they don't seek out what, the medical help that they need, and therefore their issues become worse. So this is why I believe in the single payer system. Now, for those of you who don't know what the single payer healthcare system is, the single payer healthcare system is when the government becomes the single payer. So through a tax-funded plan, your tax dollars goes towards medical costs, a universal medical plan. So in other words, you're paying taxes, everyone's paying taxes, X amount of dollars goes into this program, and then the government decides, how much medication will cost, how much, treatment will cost, how much they're willing to pay, so on and so forth. But I know it's like, oh, the government decides, the government decides. The way I want to, the way I want it is that, it's not so much nitpicking with general health services, so on and so forth. These are things, for services that are necessary, especially for the quality of life. There shouldn't really be an argument about giving help, giving, treatment for those services, or giving medication for those services. I can see how taking advantage of the healthcare system, like, I don't know, maybe you have an issue with yourself, with your personal image, and you want to get, your lips boosted, or, implants, or, your nose done, or something like that, or whatever. I can see, how some people may be concerned about that, and that doesn't pertain to your physical health, and it probably damages your mental health. I don't know, but we're talking about, the issues in life, what healthcare really should be taken care of. So your taxpayers' dollars will take care of all that. Now, to better explain what a single payer system is, I've actually lived under a universal healthcare system. So when I was in the military, we were covered under, we're covered under a universal healthcare system. So when I was in the Army, we all had TRICARE. That was pretty much a must. As soon as you go in and stuff like that, they start enrolling you in all these different processes and so on and so forth. But I had TRICARE, and while I had TRICARE, I could go to a doctor whenever I wanted. I can go into the ER, get treated for whatever. My wife and kids were also covered. I've had surgery while I was in the military, as well as had to be medicated under various different medications, so on and so forth. None of that stuff cost me a dime out of pocket. Now, whatever the government took to pay for that, I was covered. I got hurt in the military. I had surgery while I was in the military. I had physical therapy, various types of physical therapy, medication. All of that was covered. My wife, she gave birth to one of my daughters while we were in the military. She also had to have surgery in relation to that. None of that stuff cost us anything out of pocket. We walk into a hospital, we get treated, we walked out. Didn't have to worry about bills hitting us up later. Didn't have to worry about how we're going to pay this, how we're going to pay that. You know, without going into too much details about other patients, there are a lot of us. I mean, all you got to do really is look at the VA. You know, you can see that a lot of veterans get messed up, and you know, during our time in service. You know, and while we're in service, we're well taken care of. I personally have no complaints with TRICARE. It was one of the, I'm not even gonna say one of, it was the only time that I was really covered with everything and didn't have to worry about funds and so forth. And I believe that all Americans should have the same coverage. We all should be covered. We should be able to go, get treated, get taken care of, go see whatever kind of doctor you need to see. I had to see specialized doctors and all of that. Go see whatever kind of doctor you need to see and get out. You know, there can be policies and things put in place to make sure that people aren't abusing the system, you know, so on and so forth. But overall, this is the kind of health care that I want for all Americans. So pretty much, you know, to keep this video short and to the point, you know, I want to implement single-payer healthcare system so that as a form of universal health care for all Americans, so that way we're all taken care of. You know, we don't have to worry about, you know, healthcare costs, or you know, you're sick or you're injured and you can't seek help, you know, because you can't afford it. By going this route, everybody will be taken care of. It should be a right, and hopefully we're all in agreement with that. So I thank you for your time. If you have any complaints, concerns, questions, comments, feel free to drop them in the comment section. If you're interested in listening to more of some of my political ideas, feel free to hit that subscribe button. Share, by all means, please share this video. I thank you for your time. Remember to go out and vote for the 2020 elections. I'm a write-in candidate. My name is Anthony Moss. Hopefully I have your vote, and I thank you for your time and your consideration.